Now, what about the numbers when you see the efficacy come out for Moderna and Pfizer? It was shockingly high, right? It was like, wow, look at these numbers. But now we're seeing this new CDC report that finds 8% of people are skipping out on that second dose, and that's 5 million people. Now, this isn't a phenomenon that is not specific to a COVID vaccine. You know, that does happen sometimes when there's two-dose vaccines. But is it because people see the efficacy as so high, or there's a fear of side effects possibly?
I think it's probably a combination of many of those things. And, uh, maybe people had a side effect and maybe they see that they're mostly protected because it probably does give 60% effectiveness or something like that. But really it's like, why have 60% effectiveness when you can go to 95% effectiveness and more than 95% effectiveness in terms of saving your life. Okay, that remember, when we talk about the vaccine effectiveness, what we talk about is whether or not you can get an infection. Well, to be honest, like, I don't really care if I get an infection, but I really care if I die from it. Okay, like if I just get a little minor infection, okay, that's a that's a successful vaccine for me and I don't die. And let's be really, really honest with people. Like, dying from this disease is not the way you want to die. Okay, that it's, you're in an ICU, it's not comfortable. Okay, and so to avoid that from a vaccine, sign me up. And of course I took the vaccine the very first day that I could. I work in the emergency department. I felt like I was swimming in the virus at times, and I was afraid. I was afraid every day that I went to work. I mean, I can't even tell you how afraid I was. And so for me, like honestly, when you know, I almost cried when I got my first vaccine because I had been afraid for so many months. I had been terrified going into the department. And so it was an easy choice, and I think it's still an easy choice for people.
You know, I'll be honest, I did cry the first time I got it. The first shot, I did cry.
I did too. I was in the room when Sandra got the first vaccine,
Oh, sure.
uh, and I was sitting there in the back, and it just like I couldn't, like, after all of those months of being afraid and seeing so many people die. I mean, I had honestly never seen so many people come in and die as what we went through. And to be honest, I'm still a little damaged from it. Like I have to, like, try to work that out. And all of America now has to work that out. And all healthcare workers have to begin to work that out. And the people who were exposed to it in the ICUs and the nurses have to work that out. And the clerks have to work that out because, we're very prepared for typical medical kind of conditions, but this was anything but typical. And the
Sure.
amount of death was just unlike anything an American physician had ever seen before.
Sure, and hopes to never see again.